Can you say a few things about Susan E.Swedo and Associates from 1998 when this first was described by that group?
Susan E.Swedo is a psychiatrist who is the head of the Division of Child Psychiatry at the NIMH, which is the government-funded research agency, the National Institute for Mental Health, within the organization of the National Institute of Health, NIH. And she was sent a bunch of patients with severe obsessive-compulsive disorder that was not responding to typical medications that usually work, such as anti-anxiety drugs and SSRIs, and none of them were working on these children. They all had what they had.
What did Dr. E.Swedo notice from her cases that were common denominators?
So she was evaluating this group of children who had a relatively early onset of their OCD, most of them under the age of 8. And she kept hearing in her interviews with the mothers, it all started after he had a strep throat. It all started after he had 10 strep throats in a row. And she kept hearing that statement over and over again, and decided to investigate the possibility that the strep itself may have done somehow something to the child that it induced this mental illness.
Okay, she noticed the common denominator was a lot of strep infections, either previous or recent episodes. Is that correct?
That's right. And she related it to rheumatic fever because in rheumatic fever, besides the movement disorder called chorea, the children with those movement disorders also frequently had obsessive-compulsive symptoms. So that's how she related the possibility that the strep could have set this off. And then she went about looking at MRIs of the brain on these children and found that the center in their brain called the basal ganglia was swollen, which indicates inflammation. And she put together this whole concept that the brain gets inflamed in that area. In this region of the brain called the basal ganglia, the area that would be triggered in depression, anxiety, or other mood issues, rage, those areas are all in that region. And the movement disorder area is in the same area. They both are in the same region of the brain. So she put 2 and 2 together and thought of this as possibly being triggered like strep, by strep, like strep triggering rheumatic fever, that strep could also trigger a non-rheumatic fever brain change that she labeled PANDAS.
Did she come with any treatment at that particular time?
Basically not. She postulated that the use of antibiotics might work, and actually in some children putting them on antibiotics actually did simmer down their symptoms. If you talk to Dr. E.Swedo, she basically does not have a method for treating this condition outside of some very dramatic methods that are used to try to clear out the immune system from the antibody that might be offended.